Okay, we've all been there, right? That miserable, head in a vice feeling of a sinus infection. You feel just awful, you want it to stop, and you think, I know what I need. But what if I told you the common wisdom is kind of wrong? We're about to break down the latest medical guidelines into a simple playbook for what actually works. Let's get right into it.
Oh, you know that feeling. It's not just a stuffy nose, is it? It's that deep, throbbing ache right behind your eyes, in your cheeks. The pressure makes it basically impossible to focus on anything. It is just plain miserable. And honestly, it's one of the top reasons people rush to the doctor looking for a quick fix.
So the official medical term is acute rhinosinusitis. Sounds super serious, right? But let's just break that down. Rhino is for your nose, sinus is for, well, your sinuses, and itis just means inflammation. So it's just inflamed sinuses. But here is the most important part to remember. This almost always starts as a simple, run-of-the-mill viral cold.
Okay, so let's dive into our first section and bust the biggest myth of them all. This idea that you absolutely need an antibiotic.
This is the classic line of thinking, isn't it? Your snot turns that lovely shade of green, the pressure is building, and you immediately think, aha, it's bacterial now. I need an antibiotic. It feels like common sense, but is it really true?
Well, the medical guidelines are incredibly clear on this. Get this, a whopping 98% of what we call sinus infections are purely viral. Only a tiny, tiny fraction, we're talking just 2%, ever develop a secondary bacterial infection that might need treatment. Let that sink in for a second. For 98 out of 100 people, the cause is just a virus.
And that is the crucial point right there. See, antibiotics are designed to kill one thing, bacteria. They do absolutely nothing against viruses. So since the overwhelming majority of these infections are viral, taking an antibiotic is like, trying to fix a software bug with a hammer. It's completely the wrong tool for the job. Your own immune system is already built to fight off that virus.
And here's where it gets even crazier. Let's look at the risk versus reward. To get just one person to feel better a little bit faster, you have to give antibiotics to 18 people. But at the same time, 1 out of every 8 of those people will get side effects like nausea or diarrhea. The math here is pretty simple. You are more than twice as likely to be harmed by the drug than you are to be helped by it. It's just not a good bet. And this quote from the guideline, this explains everything. The pain you feel, it isn't from some bacterial army attacking you. It's just simple physics. Your nasal passages are swollen shut, and that traps fluid and creates a ton of pressure. An antibiotic can't fix a blockage.
Okay, so if antibiotics are out, what actually works? Let's get into the stuff that targets the real problem, the symptoms.
The evidence-based approach is really simple, and it's all about comfort. First things first, painkillers. Paracetamol, ibuprofen, they directly tackle that awful face ache. Second, saline solutions. Whether it's a gentle spray or a full-on rinse, they help to thin out mucus and wash everything out, which promotes drainage. And third, steam. Inhaling steam can give you some amazing, even if temporary, relief from congestion. Just please be super careful with hot water. Never ever use boiling water, and keep it below 60 degrees Celsius to avoid any burns.
Now I know what you're thinking. What about those over-the-counter decongestant sprays? For years, they were a go-to recommendation. But you really need to pay attention here, because the latest guidelines have changed a lot, especially when it comes to kids.
Okay, for children under 2 years old, these sprays are no longer recommended, period. The risk of rare but really serious side effects is just too high to justify it. Now for kids between 2 and 6, they're basically a last resort. You should only use them with caution if saline isn't cutting it and the child is truly miserable. This is a critical safety update for every single parent out there.
All right, so 99% of the time, a sinus infection is annoying, but it's harmless. But it's so important that you know about that other 1%. So this section is all about those rare but very serious red flags that mean you need to get medical help right away. So these are not your typical sinus symptoms. We're talking about major alarm bells. Any change in your vision, like double vision, swelling or redness around just one of your eyes, a severe one-sided headache, or swelling on your forehead. And if you start experiencing confusion or severe nausea and vomiting, that's a sign the infection may have spread. That is a true medical emergency.
But let's be really clear here. These complications are incredibly rare. We're talking odds of less than 1 in 30,000. So this information isn't meant to scare you. It's meant to prepare you. Knowing these specific red flags allows you to confidently manage a normal sinus infection at home while also knowing exactly when it's time to call for urgent help.
So, let's put it all together.
This is your new evidence-based playbook for the next time you feel that awful sinus pressure starting to build.
So to recap the big stuff. First, remember, it's almost always a virus and it will get better on its own. That means you can skip the antibiotics. They're way more likely to cause side effects than to actually help. Instead, you're going to focus on symptom relief, painkillers, saline, and steam. You're going to keep those rare good critical alarm symptoms in the back of your mind. And finally, you're going to trust your body and your immune system to do its job.
So I'll just leave you with this question. The next time you feel that pressure building, what are you going to do differently? Now that you understand the real cause and the most effective treatments, you can take control, feel better faster, and avoid medications you just don't need. Thanks for tuning in.